Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Abdullah. May I know what brings you here today? Okay. Anything else? Okay. I'm very sorry to hear about this, Mrs. Abdullah, and I totally understand it how these things were for you while being pregnant, and I really appreciate that you are concerned about your health. Is there anything else you like to add? Okay. Okay, so Mrs. Abdullah, let me summarize that you are pregnant for second time and it's your second trimester, and in your previous pregnancy you become diabetic, but later on you become okay, and this time your urine test, even at this time your urine test had no sugar at the diagnosis of pregnancy, and your OGTT at 16 weeks was normal, and you have come to discuss a second report in which you recently ordered OGTT at 24th week. Shows abnormal result of 250 milligram per deciliter at 2 hours, and few days ago you visited a GP due to your high blood pressure, and you are taking SC inhibitor. And lisinopril 2.5 mg for your blood pressure, and you forgot to tell a GP that you was pregnant. That's all? You want to add anything else? Okay. Okay, and so Mrs. Abdullah, before I jump to the management part, I would like to ask you a few more questions. Is it okay with you? Thank you, Mr. Abdullah, for your cooperation. So may I ask the size and weight of your born baby? And if he was healthy? Okay. And what was your mode of delivery? Okay. If you developed any complications in previous pregnancy? And do you know your weight? Okay, more than 30. Okay, BMI. Okay. And how's your sleep? Okay. Okay, Mr. Abdullah, can you tell me if your any immediate family member is suffering from diabetes, blood pressure? Okay, I'm very sorry to hear about it. Okay. Okay, so Mrs. Abdullah, let's come to the management. Okay, but let me reassure you first that diabetes developed during pregnancy is called gestational diabetes. Okay, and 2% of the pregnancies are affected actually. But in gestational diabetes, no oral hypoglycemic can be given. So I'll refer you for admission to endocrinology department for the start of insulin. Okay. But we need to keep our fasting blood sugar less than 100 milligram per deciliter. Okay, and purpose of such tight control is to decrease congenital anomalies to the minimum. Okay, and you are advised to keep tight control of your sugar with appropriate dose of insulin. Okay, and avoiding episodes of low sugar attack. Okay, is everything clear? Should I repeat it again? And hope your second pregnancy remains uneventful. Okay, so I'll strongly recommend you to try to have a healthy diet comprising of 5 portions of fruits and vegetables. Okay, and try to have a brisk walk 30 minutes per day for 5 days a week. Okay, and you can also it's up to you. You can also walk for 150 minutes per week. Okay, it's totally up to you what is feasible for you. Okay, and immediately after the delivery of your child, insulin will be stopped completely. Okay, Mrs. Abdullah, and your oral OGTT test will be done at 6 weeks after the delivery. Okay, and it is likely that gestational diabetes reoccur in future pregnancy as well. Now 30% of women develop permanent diabetes in less than 10 years. Okay, so there's a reason you have to keep tight control of your sugar. Okay, is everything clear till now? Okay. Okay, Mrs. Abdullah, and I'll refer you for the eyesight. Okay, make eyesight worsen during pregnancy. It also check your visual acuity and change the lens of your spectacles if needed. Okay, and can you do it? Okay. Okay, and that endocrinologist will refer will start insulin. Okay, and he'll also tell you the safety nettings, like you can have hypoglycemic spells. Okay, if you think like you have tremors, sweating, and you feel dizziness like that, so you can take any sweet thing, sugar or honey or sweet biscuit. Okay, can you do it? And I try to avoid stress. Okay, and try to adopt a healthy diet, healthy diet and healthy lifestyle. Okay, and is there anything else you would like to ask me today? Should I summarize all again for you? Okay. You need not to be worried, Mrs. Abdullah. I'm here. Okay, I'm here, and I'll summarize it again for you. Okay, and so firstly, we talked about your first pregnancy, and secondly, we talked about your OGTT test, which came abnormal this time, and thirdly, we talked about insulin to be prescribed by endocrinologists, and fourthly, we talked about family history. Okay, and sixthly, we talked about previous pregnancy, if you had any complication, on what was mode of delivery. Okay, and then we talked about about a pregnancy, that how it is common and how pregnancies are affected. Okay, and then we talked about what you should do, and what you should try to avoid. Okay, and then we talked about your healthy the diet comprising of portions of fruits and vegetables, and then we talked about brisk walk for 30 minutes. Okay, and then and then we talked about that after your pregnancy, your insulin will be stopped, and you will be advised for a glucose tolerance test again after 6 weeks of your delivery. Okay, and then we talked about you should be checked by ophthalmologist. Okay, for your eyesight. Okay, and is everything clear till now? Okay, is there anything else you want to ask me today? Okay, Mrs. Abdullah, here's a leaflet. It includes all the information regarding gestational diabetes. Okay, and I hope it will be helpful for you. Okay, and it includes all the lifestyle changes, and how what you should adopt, and safety nettings. Okay, so it is very useful, and I wish you a healthy pregnancy, and without complications. Okay, and take good care of yourself. Bye bye.